Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Calciphylaxis. Calciphylaxis. What is calciphylaxis? Calciphylaxis is a type of extraskeletal calcification. Okay. Calcification, right. In calciphylaxis, it is actually a devastating condition which is seen. In this calciphylaxis, it is mainly seen in conditions in the patients of advanced chronic kidney disease. Here in calciphylaxis, there is calcification of the soft tissues is seen actually in the vessels surrounding the vessels. In calciphylaxis, if this is the vessel surrounding the vessels, there is calcification will develop surrounding the vessels. So that is calciphylaxis. So pathologically, if you do a pathological or histological examination of the lesions, you will see presence of vascular occlusion will be seen. First, there is extensive vascular calcification will be there. There is extensive vascular calcification. This extensive vascular calcification will lead to the vascular occlusion, resulting in calciphylaxis. Then second, in calciphylaxis, it presents as livido reticularis. First, there is livido reticularis will occur first, and later it will progress with patches of ischemic necrosis are seen. Okay, this is mainly seen in legs or thighs, or it can be seen in abdomen of the patient or the breasts of the patient. So
thank you and thank you for watching.